Welcome to Health Yeah, where experts from Stony Brook Medicine come together to discuss topics ranging from the complex inner workings of an infectious disease to tips and tricks for staying safe and healthy all year long.
Welcome to our podcast. I'm Dino Spagnoles, Director of the Bariatric and Metabolic Weight Loss Center at Stony Brook Medicine. For the past few years, GLP-1, glucagon-like peptide-1 medications have become a frequent topic of conversation around weight loss and weight management. By definition, GLP-1 is a hormone released by the intestines after eating, signaling fullness to the brain, slowing digestion, and helping the pancreas release insulin to regulate blood sugar. The GLP-1 receptor agonists are medications designed to mimic this hormone to help you feel full longer, reduce appetite and food cravings, and regulate blood sugar. My colleagues and I are here today to discuss the various types of GLP-1 medications, their uses, whom they benefit, and the outlook of medication-assisted weight loss in general. Before we get started, I'd like to ask my colleagues to introduce themselves. Dr. Panayotou.
Hi, I'm Dr. Politia Panayotou. I am an internal medicine and obesity medicine specialist, and I'm practicing here in Setauket.
And Dr. Forohar.
Farzad Forohar. I'm a gastroenterologist. I practice in Smithtown.
Great. Let's get started. So what are the different types of GLP-1 medications?
So there's two different categories, and I'll go into detail with both. There are the GLP-1s like you discussed earlier. There's ones that are strictly for weight loss and then for diabetics. So the ones that are for the diabetics are Ozempic, which you have heard out. That is for diabetics. And then also for weight loss, that includes Wegovy. The other class that I wanted to branch on was the GLPs plus an additional hormone, GIP hormone. That is an additional hormone that we have found that helps more with staying full. The two different medications there include, the one for diabetics include Mounjaro, and then there's Zepbound. Those medications also, some of them have found there have been indications for both. For the GLPs, there has been the indication for diabetes, like I said, for Ozempic, and also for cardiovascular disease for both Ozempic and Wegovy. For Zepbound and its counterpart Mounjaro, Zepbound has been found to be approved and indicated for obstructive sleep apnea, and Mounjaro for strict diabetes. There's also been out in the market some compounded versions of these GLPs and GIP hormones. However, it's not widely studied. Their efficacy and safety is not really there and published. So those are medications that that we have not really been experienced with and don't really know what are the side effects at this time.
Thank you. So, Dr. Forohar, how do these medications work for weight loss?
The most important thing is at the central nervous system, in the brain. We have a hunger center there. It sets the temperature lower, meaning that we believe that every human body may have a thermostat-like setting. Like your home, you have a temperature at 72 degrees, and your heater and air conditioning work in order to maintain that temperature. We may have a set point in our brain that sets certain weight for our body. So part of this is hunger center. When these medications act on central nervous system, they actually tell the brain that eat less. That constant food noise that many patients feel gets alleviated. That's really the central mechanism of action. It has other properties as well, as you alluded to, by digestive system, making you feel full. And with that comes the sensation of nausea and slow gastric emptying. So this is the other mechanism of action. The other one, metabolism may also increase. So these are the three different ways.
So how have GLP-1 medications changed the way clinicians think about obesity and metabolic disease in general?
Very good question. This is no longer considered a willpower. This is a biologic disease. This is not a matter of not having discipline. So by clinician understanding this concept that this is like diabetes, like certain other diseases that have multiple sources, we don't put blame on the patient any longer. And that is really alleviating a lot of guilt that many patients may have felt before.
That's very insightful. Thank you. Dr. Panayotou, who is a good candidate for using GLP-1 medications for weight loss? And then what conversations really should happen between the patient and the healthcare provider before starting them?
Very good question. So as far as criteria and indications, criteria meaning anyone who has a body mass index greater than 30, that's basically calculated off of height and weight for that individual. 30 or over, typically most insurances will cover these medications, and also anyone with a body mass index of 27 plus one comorbid condition relating to weight. And those conditions can be such as diabetes, prediabetes, obstructive sleep apnea, fatty liver, heart disease such as history of stroke, and history of myocardial infarction or heart attack as well. The discussion I typically have with my patients is that these medications are a tool. They help jumpstart your weight loss journey in conjunction of what you have already or should have already been doing from the get-go, such as diet and exercise. I always tell my patients that these are not a Band-Aid, that these medications really, like I said, are a tool that you have to be on a high-protein diet. Also need to be, if you haven't already seen, someone for diet counseling, that is also advisable. And also moderate intensity activity is also highly advisable with these medications. Also, sleep is very important with these medications because the more sleep you get, such as 7 to 8 hours, that will help boost your own GLP hormone that we already make in our body. If we don't get enough sleep, we make a hormone such as ghrelin, which is the hunger hormone that will kind of sabotage these medications that we're taking to help lose weight.
That's a great explanation. Now, in a similar way, who is not a good candidate for these medications? Patients
that are not good candidates, obviously, initially are patients who are already kind of in the normal weight range. We think that is, inappropriate. Patients who are not good candidates, absolute contraindications to these medications are patients who have a history of obstructive gallstones, history of pancreatitis in the past, history of also medullary thyroid cancer, which is a rare thyroid cancer, but it was found in rodents too, that these medications did cause that cancer to come more about, and also multiple endocrine neoplasia syndrome that runs in the family as well. Also, we don't like to add these medications to anyone's regimen if they are currently pregnant or also breastfeeding as well.
Very good. That's a great explanation. We often hear from patients that they see stories and they hear their friends who have had great successes, and sometimes that puts a lot of pressure on them. From your experience, do these medications work for all patients?
They do. However, it is variable across the board. Again, some patients do everything that's advisable along with these medications, diet and exercise. They get up to the maximum dose, and sometimes it doesn't quite help them. That happens a few times in my practice. But other patients, we do see quite a bit benefit, and especially those who have chronic obesity. We found that these medications are very helpful with them with keeping the weight off long term as well.
Very good. And then similarly, do they work differently between men or women?
I have not witnessed that. In fact, I found that females are coming more to me because they're hearing their friends are losing weight with medications, particularly those who are perimenopausal or postmenopausal. It very helps much so with, getting that weight off that they were unable to lose. They were just in a standstill during menopause, and they looked to these medications as a kind of like a savior for them to help them go back to their initial weight where they were pre-menopause.
Now, as patients use these medications, have you seen improvements in their quality of life that maybe are not reflected on their scale?
Absolutely. The first thing is I always hear from patients is that they always say that they have more energy. They also just feel less achy in general. And overall, those who have chronic osteoarthritis, we find that, that is much more relieved with these medications. Also, we see in blood work, we see as far as like improvement in metabolic panels, such as their sugar levels and also their cholesterol levels. And also over time, blood pressure comes down as well.
Very good. Dr. Farrojar, we touched on this a bit up to now, but what other conditions can be improved or treated with GLP-1 medications? We've already mentioned heart disease and sleep apnea.
One thing that is dear to me is liver disease. And fatty liver is a very common problem nowadays in society, particularly in women, I should say. It's really not exclusive to women. Currently, fatty liver is number one reason women get liver cirrhosis. Alcohol is number two. In men, alcohol is number one, and fatty liver is number two. So Wegovy, semaglutide, just got approved for this indication. So by prescribing this medication, we actually hit multiple targets. The weight loss, obviously, and liver fibrosis also decreases, hoping by that process, the development of liver cirrhosis will be, if not abated, but maybe even delayed. We don't have the long term. It's been only studied for, I believe, around 72 weeks. But the expectation is that it will reverse liver fibrosis and by that, liver cirrhosis. Other conditions, obviously, one thing that is also that is exclusive to women, polycystic ovarian syndrome. And these patients, unfortunately, do weight gain, not because of, again, willpower, but because of the hormonal insulin level, etc. And these GLP-1 medications may help in that regard as well. I believe we touched upon osteoarthritis, we touched upon sleep apnea, and one of the reasons that patients immediately may feel less tired is by improving their sleep apnea.
Yeah, these are really remarkable benefits. Dr. Panayiotou, for which conditions are GLP-1s now more and more being considered earlier rather than leaving them as a last resort?
First thing is that diabetes management, now these medications have totally replaced the other prerequisites such as metformin and other class drugs that we use for diabetes. And we jump straight to that and we see better control right from the get-go with diabetes. Also, as Dr. Farrojar said, for obstructive sleep apnea, we see when we add this too, that helps with minimizing that. And with cardiovascular disease, I even see cardiologists starting to prescribe these medications as well on their own with, to help more with their cardiovascular benefit.
Yeah, very good. Dr. Farrojar, how do these GLP-1 medications compare to older medications or even lifestyle-only approaches to treatment of obesity or health conditions associated with obesity like fatty liver disease that you just mentioned?
Right. I would describe the older medications being in minor league versus this is the major league. So it's really those older medications, anywhere between 3 to 5 to 7% weight loss. That was under ideal conditions. So they are really not comparable. We have another medication that is approved for fatty liver, but that medication, trade name being Resdifra, is really only indicated for fatty liver. It doesn't have the other benefits that GLP-1 have, which we already covered. So again, it's really what I describe as major league versus minor league.
Similarly, as you mentioned earlier about some of the nausea or other impacts of the medications, What side effects are most often reported by patients on GLP-1 medications, and what's the connection between side effects and dosing, perhaps?
So the most important side effect probably early on is nausea. And it is kind of, we expect that because it causes stomach we call it delayed gastric emptying. When stomach is distended and is not emptying well, it causes nausea. So that's why we have a dose, we start at the lowest dose and gradually increase, hoping that patient will assimilate to the new condition. Constipation, vomiting, even diarrhea, there are the other common side effects of these medications.
Dr. Panayotou, what can patients do to reduce those side effects?
I always like to address first the timing of the medication and how they're taking it. First is, I always say, either 1 hour before their first meal of the day, or if they like to take it at nighttime, if that's what their schedule allows, it's better for them, for their convenience, 3 hours to 4 hours after their last meal of the day, but closer to bedtime. Also, I always like to circle back to their diet. Are they eating larger portions and trying to push through the meal? I always like to tell them that they should really listen to their body, slow down eating when they start to feel full so they don't feel that nauseousness. Also, water is their best friend. They need to be drinking up to 64 ounces to a gallon of water a day to help mitigate the other side effects that Dr. Farrohar mentioned, like such as constipation. And also, they would need to possibly take stool softeners if need be to help with the constipation. Very rarely do I have any patients say that they have diarrhea, but on those rare occasions, they could use, symptomatic relief medications over the counter for that as well.
And we mentioned earlier that there's a lot of variability in the effect of those medications. Who is really successful using those GLP-1 medications?
So those who are successful really, again, are those who are adhering to the lifestyle changes that we discussed. Also, I also like to mention that those who are, exercising again, and long-term use tends to show more success. If someone is stopping, restarting, or just non-compliant in general, they will not be successful. Those who have chronic obesity, I have noted that they will be more successful in the long term if they remain on these medications, who have been battling obesity since childhood. Those are the patients that need to be on these long term, and they will see greater success.
And that's something that I've noticed in our practice too. And oftentimes within 3 months, you can already see who's a responder and who's not, and who's going to benefit from long-term use. Dr. Farrohar, how do GLP-1 medications affect muscle mass, and what can patients do really to protect their own muscle?
Thank you for that question. That's really, really very important. Patients may lose 20 to 40% lean body mass. So it's very important to have a high intake of protein between 1.2 to 1.5 gram per kilogram of body weight. So let's say if you are 100 kilo, which is 220 pounds, so you need to probably get 150 gram of protein a day. And ideally, you should start your meal with taking the protein first before you become full and stop eating. So start the protein, then move on to carb. And then the other important thing is weight-bearing exercises, not cardiovascular, not being on the treadmill, lifting weight. You don't have to become a Arnold Schwarzenegger, but you need to increase muscular exercises, toning your muscles.
Dr. Panayotou, who currently has access to GLP-1 medications and who doesn't? I know that's always a moving target when we counsel patients, but tell us a bit about that.
Yes, and like you said, it is a constantly changing landscape in your question, but it basically depends on the insurance that the patient has. Also, if they meet those criteria that I discussed earlier, but particularly usually the commercial insurances mostly cover these. If you meet the BMI 30 or over, or 27 BMI plus comorbidity, or if you have those indications that we discussed, obstructive sleep apnea, cardiovascular disease, And also diabetes is a big one that's usually always covered for most GLPs. Again, there are the rare exceptions for certain insurances. But now there has been more options now that if the patient is unable to get these medications covered through insurance, they are offering them out of pocket. And because these medications are such life-changing medications, a lot of patients are opting to invest in taking these medications as in the hopes of minimizing their other comorbid conditions. So, each pharmaceutical company has formed cash options to get the oral options versus the injectables as well.
How about the future of GLP-1 medications?
The future is endless for these medications. They are here to stay. And if not, they're going to keep getting better and better. And there's going to be more and more hormones being added to the GLP combination. Like I said, there's the GLP and then there's the GLP plus the GIP. And now there's studies that they're going to be combining another hormone to make a three hormone medication, basically. So it's in the horizon. Now they're coming out with even oral options to these injectables as well, one of which has already been out the last 2-3 weeks now. So it's endless.
It really is. Well, thank you for the thoughtful discussion. That's all the time we have today. I want to thank Dr. Panayotou and Dr. Forouhar for your time and expertise, and thank you to our viewers and listeners. For more information, please call 631-444-2274. If you found this conversation interesting, don't forget to like and subscribe for more informative health-related content.
Stony Brook Medicine is Long Island's premier academic medical center. We transform lives through scientific discovery, education, and care, and we bring together innovative research, advanced education, and extraordinary healthcare expertise to set the standard for how healthy communities thrive. For more information, visit stonybrookmedicine.edu or follow us on social media, Stony Brook Medicine on Instagram, Threads, Facebook, YouTube, and LinkedIn, and Stony Brook Med on X.